is there any special trimester that is more risky than another?
Okay, so talking about the first trimester, of course, the risk of miscarriage is much higher. So we must remember about that. So the risk is 10% that a woman can lose the pregnancy.
Welcome back to another episode of the Next Gen PT with the PTBA, and I have the wonderful, the amazing Dr. Anna Szumilewicz with me. She is a regular professor in Poland, in Gdańsk. But you know what, Anna, I'll let you introduce yourself.
Okay. Thank you very much, Alesh. Welcome, everyone. It's really a great pleasure to have the opportunity to talk about pregnancy and postpartum exercise. And as Alesh mentioned, I am an associate professor at Gdańsk University of Physical Education and Sport in Poland. But we have a huge collaboration all over the world. So I have a pleasure and honor to work with people from Africa, from North America, from around Europe, and from Asia. And it's a really huge collaboration, and we would like to spread the knowledge. We would like to spread the evidence base that we collected together. And we would like to educate exercise professionals how to plan and how to implement exercise programs for pregnant and postpartum populations. So my main work is to translate science into practical guidelines, and exercise professionals is one of our targets. And of course, we would like to educate pregnant individuals, pregnant women, because it depends what country we are in, because some countries use the term women, sometimes are a little bit afraid of using the term, and we use individuals. So it depends where we are. So it doesn't really matter where we are, but of course, pregnant people are our target. So we would like to provide them with a good service in terms of exercise and physical activity programs. So this is my main goal. And I would like to share some tips for you during this short podcast today.
Okay, I see. So here's my take on it. Before we even move further, for me, only females can be pregnant. So I'm really comfortable using the term women. Yes. I'm old school. So I'm really sorry to mention it, but I just don't buy in that, because it's where I'm from, how I've been raised, and so on and so on. So it's for me, that's okay. Anna, so you try to educate people on these topics, especially about pregnancy combined with training, physical endeavor, and how to do it better and more right. But there are so many misconceptions right now on the market. What is okay, what isn't okay, how it should be, how we can do it differently. Or there are especially influencers out there, claiming all sorts of stuff. How do you, as a professional in that field, not only as a professional, because you've been a trainer for yourself for how many years? Many years, right?
Better not to say, Alesh. It's better not to say, but I can say it's more than 2 decades, so it's enough, okay. Right? So you don't ask women how old you are. So I started early, and I've been in the market for a long time. So I have some experience being a trainer and instructor, and it's really a very, very nice experience to work with pregnant and postpartum women. So of course, you said about the influencers. So I hate influencers, especially if they don't read evidence-based papers. Of course, we need them sometimes to promote some approach, but this is my request to them: before you do anything, before you say anything as influencer, so please read what is currently updated, the guidelines, the papers, the recommendations, because sometimes we can see that there's a lot of myths around physical activity during pregnancy and postpartum, and sometimes the myths are very harmful for women. So especially those myths related to the limitation of exercise, limitation of intensity, sometimes, trying to put a woman to the bed for the whole pregnancy. So these are very harmful myths. And we are trying to fight against this myth. especially using the evidence-based knowledge. So you mentioned some is related to specific exercises. What I can say, it always depends what kind of client you have, and each pregnancy is individual, so we have to have individual approach. But for sure, we don't have the list of what we shouldn't do. Okay, so we don't have don't do that list. And it always depends. It always depends on the exercise capacity, of the technical abilities of a client, and we always have to take into account the course of pregnancy, the health status, and of course the skills. First of all, the skills and comfort of a woman. So these are my tips, first of all.
I see. First of all, yeah, I hate that influencer bunch as well. Not per se, but the things that we can hear and see on the market is just horrendous at times. What they put out, and the problem that I see, and that's one of the reasons why we invited you, in our schools and in our fields or in our markets to teach so many times, was because I really am looking forward to make things better and to provide a knowledge that is evidence-based, science-based, and practically applicable, because that was one of the main reasons for me that we've reached out to you especially. The problem that we have in the education field today is that many influencers that are just selling those myths all across the board are today organizing seminars to teach women how to act, how to train, or better to say, how to not train, because that's their selling model. And they're just pushing out so many more myths. I mean, there were some crazy things that I've heard in the past 5-6 years when I paid a bit more attention, thanks to you, to what's going on. So, for example, if we would break it down, as soon as you get pregnant, so what would be okay, or what would not be okay to do in the first trimester? Or is it, maybe another question before that, is there any special trimester that is more risky than another?
Okay, so talking about the first trimester, of course, the risk of miscarriage is much higher. So we must remember about that. So the risk is 10% that a woman can lose the pregnancy, but it is natural abortion, and we actually cannot do anything about that in terms of our lifestyle and in terms of exercise especially. So of course, this woman should avoid stress, should lead healthy lifestyle, but exercising actually cannot do anything about that. So I would like to say that exercise will support the pregnancy, but actually it's not the moment for that. So the better moment to use exercise for supporting the development of pregnancy would be the period before pregnancy, to support the body to be prepared to support the development of pregnancy, right? So it would be better. But when a woman got pregnant, so it's time to relax and also to do what she likes to do. And if she was not active, she for sure should start exercising, at least in line with the current recommendations. So it should be around 150 minutes of at least moderate intensity exercise. So it should be at least like that. But if she was much more active before, so she should continue it as long as she feels comfortable with the exercises. So if she was jogging before pregnancy, she should continue. If she was cycling, it's okay to cycle still. And if it was a little bit maybe more dangerous kind of sport, so it is always good to consider the risks of harms, of injuries, because it's not a problem to, so usually the form of exercise is not dangerous for the fetus and for the pregnancy development, but the injuries can be problematic because you cannot use some treatments, you cannot use some drugs, even the painkillers during the first trimester and even later during pregnancy. So it's better not to harm yourself. So some technically complicated forms of exercise should be reconsidered, because sometimes what we see that a woman is continuing some gymnastics or very difficult skating or rollerblading. So she
Yeah.
must consider it. So it's not that it's forbidden, but she must consider it. She still feel okay with this exercise. Okay, because if she was doing it every day, so she can continue it. She probably feel still comfortable during this exercise, but it's always very, very individually assessed.
So basically what we say is that exercise on its own has very little impact on the fetus in the first trimester. And for example, combat sports are always, on the rise, or in the first means where we say, yeah, well, you better should not do it. What if we can, just change the combat sport? So you would probably not go into sparring, but you can still go and train for kickboxing, like punches, kicking, and so on. But you're not in the direct combat. For cycling, for example, would it be advisable not to cycle outdoors, but you just transition into indoor cycling because it's less probable that you fall down,
It's, of course, so the transition from, regular cycling to indoor cycling is okay, but I would not recommend even this, okay? Because still, if you are in natural environment, you feel much better and you have more oxygen for your body, not being indoor. So if you have good environment for that, I would recommend continuing. Even some Scandinavian countries have the recommendation to continue active transportation using cycling. So it is official recommendation for pregnant women. So I would not be worried about that. So maybe I would reconsider, being very high in the mountains using bicycle and, being an athlete. So it's of course always difficult. But using bicycles just for active transportation to feel comfortable in the nature, it's a perfect form of physical activity, and I would not be worried that something can happen. Of course, traffic accidents are dangerous, so maybe not crowded streets, maybe not not prepared surface for cycling. It's risky, but not everything. And coming back to the combat sports, yes, you said that we can maybe avoid sparring element of this kind of physical activity, but of course all the technical exercises can be continued even with higher intensity. But coming back to the sentence that you said about that we cannot influence the fetus through exercise. So during the first trimester, it is true that the mother is not directly connected to the fetus because the placenta is developing, but some connection is, and we must remember about that. And first of all, through exercise, we can support what's going on in the mother's body. So it's not that
positively,
yes, of course. So we have, for example, the problems with metabolism. So the risk of gestational diabetes, the risk of hypertension, changing the lipid metabolism. So everything is influenced by exercise. So even if in the first trimester, we cannot directly support the fetus. So through the mother body, through her better functioning, we can support the fetus later in the second trimester, in the third trimester, preparing the placenta development and supporting the baby with better nutrients later when the pregnancy is progressing. So it's not so easy to say that no impact, but we don't have much evidence that actually it works, right? So I would say something like that. But first of all, it's not related to the higher risk of miscarriage, because
that was my point. That was my point. What I tried to say.
Yes. So a woman should not be afraid that being physically active, she will increase the risk of miscarriage. It's not true, for sure. We have the data from around 53,000 of pregnant women, and it was a huge systematic review by Professor Margie Davenport and her research team from Canada, and we have evidence that there is no higher risk of miscarriage or any other problems related to fetus health when a woman is active. So of course there are some concerns related to higher intensities because we don't have data on that. So we cannot say it's risky, but we should say we actually don't know. So you must observe your body, you must be monitored maybe a little bit more often if you exceed the guidelines. So the guidelines are clear that we know that moderate to high intensity is okay, but exceeding the level, like we use the Borg scale from 0 to 10, and it will be around 8 or 9, or when we use the Borg scale from 6 to 20, and it will be like 17, 18 or higher. So you must be monitored maybe a little bit more often to check if the baby is not, so that the progression of it is not disturbed through exercise.
It just makes sense, doesn't it? Because usually, unless you're doing any kind of a pregnancy test and your hormonal changes already started to kick in, usually most of my clients in the past 24 years when I was a trainer, or am still a trainer, didn't know that they were pregnant until week 5 or 6. So when they notice, oh, okay, something's happening to my period, I don't have it anymore, so now I'm going to do a pregnancy test. So it just does, add up to that. It makes a lot of sense that you don't have to be too afraid to exercise or do any kind of training in the first trimester. But what happens in the second then? So what would be the difference between the second trimester and the first?
Okay, so first of all, during the second trimester, the mother feels much safer because of the placenta development. So the baby is well supported by the mother already. The placenta should be properly developed, and she feels much better. So the first symptoms of pregnancy, which sometimes can be not very pleasant for her, like feeling tired or headaches, or what she sometimes doesn't know what's going on with the body. So during the second trimester, she doesn't feel so often these discomforts, and she usually has more energy, and the exercise is much more pleasant. The belly is not so big as in the third trimester, so many exercises are still comfortable and easy to be performed. And so the general recommendation is to continue what she was doing during the first trimester if she was active. And of course, if she was not active, so she should start again at least the 150 minutes of moderate to high intensity exercise. And again, it can be everything she feels okay in. All right. So walking sometimes is the most recommended form of physical activity, but
and
from
the easiest one to implement.
Walking is not good for the back. It can be okay for the back, but it must be so walking is not easy. When a mother has a big belly and she doesn't keep proper posture, and the gait pattern is changed, so sometimes after a long walk she can feel more severe back pain, and therefore I recommend marching instead of walking. So being more activated, the whole body is activated, we have proper line of the body, of the spine, and first of all the abdominal muscles are activated. But jogging is the best version of this kind of activity. So a little bit marching, jogging, so it activates the body to proper posture. So in terms of jogging or running, the only concern is the urinary incontinence that can be more severe during high impact activities. So sometimes if a woman feels that there are some symptoms of pelvic floor muscle disorders, so it's better to go to a specific physiotherapist who is specialized in pelvic floor muscle problems, and we can assess if she needs maybe some more intensive support like biofeedback or some kind of physiotherapy to support pelvic floor muscles. But of course, the general recommendation for all women, it doesn't matter what age, it's pelvic floor muscle training on regular basis, but during pregnancy and postpartum, it is must to be done. And without that, I cannot imagine any training. So it should be an element of every single session. and even between the exercise sessions, just watching TV or doing something, sitting or standing or walking, she should have some short activities, some short contractions of pelvic floor muscles, and it should be done like we have so-called quick flicks, so contract and relax pelvic floor muscles, and then we can have a little bit longer, like contract and keep the contraction for 10 seconds. You can extend the time for 20, 30, or 60 seconds of contraction. And very important thing, also to practice relaxation, because we need relaxation to release the pain, to release the hyperactivity of pelvic floor muscles. So when the muscles are very, very much contracted and sometimes can be painful, so we need relaxation. And also it's important as an exercise to prepare for birth, natural birth, using the pelvic floor muscles and to relax pelvic floor muscles to support the proper, going the baby through the birth canal to the world. Yeah.
I see. We're talking what? Is it just Kegel exercises that are well known, or is there something more? Do we have anything, where could we lead our clients, for example, or if there's a link where I could just, lead our listeners to where to get more info about these exercises?
You mean the pelvic floor muscle exercises?
Yeah, that I can do.
So during our seminars, we have a special part, how to teach women to contract pelvic floor muscle, because this is the problem usually, that they can read nowadays actually everywhere. So all the portals, websites, booklets, and promotional materials have this information that they should exercise pelvic floor muscles. But sometimes they say, okay, I know that I should exercise, but I don't know if I'm doing it correctly or it will be effective or not. So the first important thing is to teach them how to contract and relax. So for exercise professionals, it should be important to know what instructions they should give to a woman, to the client, and of course to support them to do it on a regular basis. So we have a lot of programs, different modes of pelvic floor muscle training. And again, we cannot say which one is the most effective. We have a wonderful program from Professor Caribou from Norway, which is very popular, but we have also other programs that we can observe different combinations of contractions, relaxation. Personally, I use the program from Professor Janice Miller from University of Michigan, which I like a lot, but it's because I like it, so I use it, but I don't claim it's the most effective ever. But we have nice observation that it works in different populations, both pregnancy, postpartum, postmenopausal women, and also we started to do this program even in young men. So male population is also our target today, to teach especially very active male athletes, especially like we have, lifting, working hard in the gyms. So even them, healthy young male participants can experience urinary incontinence. So we should exercise pelvic floor muscles as the whole population, but teaching people is very important, and instructors, coaches, trainers should know how to do that and support to keep the motivation the clients to do it throughout the life. So
and this is exactly what you do in your educational seminars, and this is why people are taking them as well, to understand how to teach.
So during the seminars, first I teach how to teach the client to do the exercise. What are the methods that the client can check, self-assess the ability if she's contracting it properly at home. And second, I try to give the set of exercises they can easily use for a few weeks with the client during pregnancy and postpartum. So as I said, it's based on the training developed by Professor Szumilewicz, and it worked perfectly. It's easy to be implemented, not only for the perinatal period, but for all clients.
I see. Okay, so that would be now a bit of coverage for the second trimester. So incontinence problems might arise or are higher than we see definitely in the first trimester. So what then? What comes in the last part? What comes? What do we have to be aware of in the last 3 months?
If we should be worried. I don't know though. I must say that the future mother, is always worried about everything. Okay, so she shouldn't be worried usually, but it's a very typical situation that she's worried about if the baby is healthy or if she's good prepared for the birth, if everything will be okay during the birth and later after giving birth, and many other things related to professional work, to the personal relationship with the partner. So many things. So it's a very common situation that the mother feels depressed and she feels a lot of anxiety related to the childbirth and generally to the changing of the social role. And we must be aware of that and support them when we observe some symptoms of depression, because it is really a very common disorder for pregnancy and postpartum period. What we know that through physical activity, we can decrease the risk of having prenatal depression by about 40%. So it's a huge number. So if we observe a woman who is losing motivation to exercise, we should continue talking to her and give them some tips that the woman should continue exercising because it helps for their mood, for their body. So this is one thing that we should be aware of psychological aspects of working out with the pregnant client. But there are more concerns related to back pain, to pelvic muscle disorders. So if any symptoms of urinary incontinence, fecal incontinence appeared in the second trimester, so probably it will be more severe during the third trimester. The belly is big and heavy, so we must remember that all exercises with the weight of body will be more demanding for a woman. So sometimes we have to adjust the load. So if we had, for example, 20 repetitions of squats, so maybe it will be enough to do 10 or 15, because when we add extra kilograms, so our legs can feel it in the same way. And we must explain to the woman that she actually is not losing her performance, the strength of the legs, but that the load is higher. And it's very typical that sometimes we have to decrease the load of the exercise because the load of the body is much higher. So some tips, we should be aware that breathing is a little bit more disturbed through the baby. The baby is higher in the belly. So using the lungs and using the diaphragm is a little bit just biomechanically disturbed. So we have to teach them properly breathe, not being aware that they sometimes lose the breathing. So it's typical reaction of the body during pregnancy. And having a lot of breathing exercises, birth preparation exercises is key importance. Okay, so exercise professionals should not forget that the third trimester is not only keeping fit, but also the preparation for birth. So birth positions, relaxation exercises, breathing exercises should be implemented in the exercise programs. Good. And you probably remember the nice sessions related to birth positions. It is always fun, especially for male instructors and coaches, that we do squatting birth position or kneeling birth position. But it's very important to teach women how to use birth position, because we want to support them to be prepared for natural birth. And these vertical positions can be very beneficial for both the mother and the baby. And we know that it can decrease the level of pain, that the blood flow is much supported in this position. It's not disturbed like in the supine classical version of giving birth.
The reason why I'm laughing is because I still have the picture in my mind when, you know, all the male trainers on our courses were doing that and laughing, you know, because it was so unusual for them. But it's very important. I agree, you know, and I've done that thanks to you again with quite some of my clients when they were pregnant. It helped. So that's a good thing. Okay,
Yes,
good. Now,
yeah, but I will also add something about, you know, the birth position, because some women know that they will not use, that they will not have the natural birth because of some you know, contraindications. There are some, and around 10-15 women should have cesarean section at the end of pregnancy. But even though the birth position are important, because they are perfect position to relax the body and to stretch the parts of the body that are very tense during pregnancy. So it's also you know, a strategy to prepare the whole body to the end of pregnancy.
So basically what a trainer should do is if we have a client that is that just got pregnant, it's our job as a trainer to take care of their well-being as through physical exercise or physical activity, which is good. That's our concern, and also prepare them for birth.
Yes. Yes, and it's not so difficult, because when sometimes I talk to instructors, trainers, so they are a little bit afraid of this part. And of course, we have special schools, birth schools. I know that in many European countries, it is a compulsory element of birth preparation. And the partner and the pregnant woman, they are taught about the birth position, breathing exercises, but it's only a few classes, a few sessions, so it's not enough. We should do it as any exercise if we would like to see the effects. Okay, so if we would like to see a nice abdominal muscle, so we don't exercise once or twice during 6 months, but we do it regularly every twice a week, 3 times a week, and then we can expect some effects. And the same is with birth position. So the body must to adjust, we must be stretched properly, and it is also some kind of psychological preparation, because the birth position can, as you remember, you can feel strange, but you should not feel strange being a woman during labor, when even if you are at the hospital. So this position should be natural for you, not feeling uncomfortable, because it's not usual position that you are using during every lifestyle and everyday, activities.
So just include it in the regular program design, and that should do it on a regular basis. So it should be a part of the training program as any other exercise. Why do you think are still so many trainers afraid to take on pregnant clients?
First of all, they have very low level of what to do, what not to do. So we did some research on the theoretical competences of exercise professionals, and they still believe in many myths. So what we mentioned, that because of too high intensity, they can cause miscarriage, and they are afraid of the responsibility that the woman will claim them. So this is the first reason, that they are not prepared theoretically, and of course later practically. But I must say that it is a very nice tool developed again by Professor Margie Davenport and her team, which is called Get Active Questionnaire. And we translated it into Polish. I know that there are many translations into other languages. Probably there are there's no translation into Slovenian, but maybe you will be the next partner for this team, because this questionnaire, in my opinion, is perfect, because we are changing the approach that this is the responsibility of a woman to be physically active. She doesn't need any permission from the doctor, because you don't need the permission from the doctor to healthy eat, to have, normal lifestyle, healthy lifestyle. So exercise is a part of healthy lifestyle. So you don't need any permission from your doctor to lead healthy lifestyle. And therefore, it's a very historical approach that a pregnant woman had to have a piece of paper when it was a signature of the obstetrician, and it was just a clearance to exercise. What we do, we use the tool, the Get Active questionnaire. So she responds by herself on some questions related to her feeling, her health status, if she has diabetes, if she has some cardiac problem, if the pregnancy is developing in such aspects properly. So there are some specific questions. And then she signs by herself, I'm aware of my health, of my pregnancy, and I, on my own responsibility, starting exercise. So this is something that the exercise professional should require from the client, pregnant client. And of course, if a woman responds yes to any of these questions, so that means that she actually has some problems, health problems. So she should be signposted to the doctor. And then this is the second part of this questionnaire, prepared for health professionals, for the obstetricians, for the midwives. And then such a woman should be under the supervision of, health professionals who should be well trained in terms of, for example, gestational diabetes or gestational hypertension. And first of all, she requires some specific consultation. So this is a very nice tool, and we must also teach exercise professionals that they are not responsible for all the problems that can occur during pregnancy. Okay, exercise works perfectly to support better health of the mother, but some complications can appear, and we can not do anything about that. So of course, it is situation that can happen. Usually it's like 10-15% of the clients that will have some problems, but usually active pregnant women have lower risk of such kind of complications.
But why is it then? What I've noticed, and I'm not the only one, when I talk to other trainers on the market, they've noticed the same thing. So many gynecologists, obstetricians, midwives, and so on, all of them are asking pretty much actively all the pregnant women not to do exercises, not to go to the fitness center, not to go to group exercise, and so on and so on. Why is this still such a problem with all the data available? Are they not reading that data? Are they refusing it? Or where exactly is the problem?
Yes, I think so that, it's maybe sometimes they read, but they don't believe. So maybe they need more time to adjust to the new knowledge. But many doctors are changing their approach. And from my perspective, it's changing for better. So I have a wonderful team of Polish doctors that cooperates with me, and we recently published new Polish guidelines on physical activity during pregnancy with a team of Polish doctors, including the president of Polish Association of Obstetricians and Gynecologists, who spread the guidelines all over Poland. So I must say that the situation is changing. So coming back to 10 years ago, 15 years ago, I remember that I really had the problem with my participants who wanted to exercise with me, and they didn't have the permission from the doctor. So it was very difficult to convince them that it's okay to exercise, to go maybe to another doctor to check again. But now more and more doctors are supporting us. But still, there is some part of them who have the historical approach. And I think that this is the responsibility of those authors who published the stupid guidelines in 80 something, so the 1980 something, that a woman should not exceed the level of 140 beats per minute of heart rate, because it can be dangerous. So it was published many years ago, but still some people believe in that. So I think that we just need more time to wait if the older generation will change the approach as well.
I know what maybe.
Yes, and you know, I will also say something, because coming back to the topic of the doctors, also a very important information to all pregnant women and also exercise professionals, that nowadays putting a woman to the bed rest is unethical activity. So if you are told by the doctor that you should go to bed and you cannot move, it is a harmful recommendation, and actually you can go to the court and say, come on, you wanted to harm me and my baby, because what we know that is the worst recommendation ever, to not to move at all. So there are some complications of pregnancy, and a woman will be forced not to exercise, not to go to fitness club. Of course, that's true, but having just everyday activity, just walking the dog, just moving around, not to spend the whole day in bed, because it is the first reason of the conditioning, and also some psychosocial problems related to, you know, feeling depressed, the family problems, because the family, sometimes the younger children don't understand why the mother is not moving now, not playing with me. And, you know, the baby starts to hate the next baby who is not even born. So some multi-generational problems related to this recommendation. Also physiology is physiology. So we are not the plants that we are not moving. We should move somehow at least, and we should, even if the pregnancy is of high risk, we must move just a little bit to have short bouts of low intensity exercise.
You've done some research on your own on high intensity physical activity during pregnancy, didn't you?
Yes, it is my best topic ever. Hit Mama project. It's my baby, and I love my project, and we have wonderful outcomes. We assess both biological, psychological, and functional parameters, how we can influence the mother and also the baby and the children, the infants, through high intensity interval training. So our participants attended the classes 3 times a week, and the intensity was set based on cardiopulmonary assessment at the laboratory. So because it was a research project, we had very good equipment for that, but coming back to the more practical environment, we can use the Borg scale. So 0 to 10, we recommended them to feel 8 or 9 in the intervals. 10 is also okay, but it is very rare that they feel so exhausted. So 9 will be perfect. So we try to exceed the anaerobic threshold, and we would like to improve both aerobic and anaerobic intensity capacity of the body, and it's really good exercise for them. So we observed better outcomes related to depression, to cardiopulmonary parameters, to VO2 max, heart rate max, and a very nice biomarker, which is placenta PLGF. So this is a marker related to the placenta development. And we observed that using HIIT, we had better levels of this biomarker. So that means that, yes, so we actually can support the development of the placenta. But these data are just pilot data, and of course we cannot generalize it yet, but we would like to repeat this project and to analyze it. So we have a very nice team. Again, it was with the cooperation of the Polish doctors, Professor Sebastian Kwiatkowski, who is gynecologist, and it was his idea to analyze this biomarker. So it's not that only exercise, scientists are interested in this topic, but also doctors would like to support the patients.
I'm glad to hear. Next time you'll be hosting one of the educational seminars and courses over here, I will definitely directly invite gynecologists and all of the others that are involved in that process, to raise awareness of that and to provide them maybe a bit more up-to-date scientific research and data on that, so they can, readjust the recommendations and so on. So that's definitely the case. Okay, I have a small list of certain things that I've observed on the market in the past few years, and I like you to help me to bust those myths. So one influencer was claiming the following: 98% of all females that were pregnant after 6 months, so 6 months after birth, they still have a diastasis recti. True or false?
Once again, so the question is
98%.
98. Actually, I don't know if so many. Probably it is probable that they have some bigger separation of abdominis muscle, but the problem is that we cannot clearly define what is pathology, what is physiology. So this is typical situation that the linea alba is stretched a lot during pregnancy, and a few decades before we used the distance of 2 finger breadths. Like, it was maybe around 4 centimeters, and everything above that level was considered as pathology. Nowadays, we can say that even more fingers is okay if the abdominals are working properly, and the function is not disturbed. We cannot observe any pain. And hernia is very, very dangerous. So even if we have 1 finger separation and it's pain and we observe hernia, so it should be treated by the doctor. But first of all, we should not be afraid of the longer distance between abdominis muscles. We must work out them properly. We have a lot of exercises that actually can contribute. We believe they can contribute to the treatment and the prevention of diastasis recti abdominis. But again, we have no clear data that this specific exercise will work for all women, and it is the only one that we should do. And it is something that is sold perfectly, that there are some physiotherapists and trainers that they sell exercises that perfectly work for all women. It's not true. What I can say, very important, is the technique of working out abdominal muscles. So we should properly breathe. We should contract the muscles together with exhalation, and we should have proper posture, not to increase the chances to separate both sides of erectus abdominis. So again, during our seminars, we have many examples of exercises, and I try to teach exercise professionals how to assess the proper technique. And actually, the list of exercises that we can do is very long, and the adjustment of the exercises is quite easy. So there is no exercise that I can say it's forbidden. You should not do that because you can decrease the risk of diastasis recti abdominis. So it's not true. Okay, so actually, I don't know the percentage. So sometimes, from my perspective, all women at the end of pregnancy have the higher separation that they had before, because it's natural. But 6 months after birth, probably it will be still higher than it was before pregnancy, but many of them probably will have quite normal condition of the abdominis muscle.
I will ask my assistant here to look it up. So if you can search for it, I believe there was around 2018-19, there was a scientist in Finland doing a huge research with over 3,000 participants, trying to find out how many percentage-wise had actually, something that could be classified as diastasis recti 6 weeks after birth, 18 weeks, and 26 weeks, I believe. So if you can look that up for me, and maybe we can get back to them. if I recall that correctly, I believe that it was somewhere around 66% right. So after 6 weeks after birth, and it fell down below 50 after 3 months and below 33 after 6 months. And if I'm not mistaken, in that study, she had to exclude those that were regularly exercising prior to getting pregnant because that was not evident. So there was way, way, way less than that. So if nothing else, if you cannot find it right now, then I will find it later on and put it up there on the screen so you guys can find it on your own. Maybe I've just did not point to the accurate numbers, so apologies for that. I will look it up again, and I will put the link to the study as well into the description here under that podcast. Okay, so you already said that, but still, if you do crunches, this is the single one exercise that you shouldn't be doing.
That you shouldn't be doing or should be doing?
That you should not be doing. That's the influencer saying.
Okay, no, we like crunches, and we have a nice study from the international team from Portugal and Norway, and maybe Spain, I don't remember. So it was, the first author was Patricia Motta from Portugal. And, and they assessed that during crunches, the both parts of rectus abdominis is in better position immediately after the crunch. And nowadays we recommend doing crunches as a preventive exercise and also in the therapy of exercise. So it was confirmed by the team, also led by Professor Caribou. So they checked how the linea alba is changing the distance between both sides of abdominis muscles. And in crunches, again, the distance was much lower. So it was confirmation that crunches and crunches with twists should be recommended. And the exercise which is commonly recommended, like drawing in exercise, so it's only the activation of the transversus muscle. So it actually made the distance bigger. So and actually it was against everything that we were taught before. And
nice.
Yes, so I recommend doing crunches. I believe they work, but still I must say it clearly, we don't have good evidence to say that it will always work. So it's to be checked for every single individual, how the muscles are behaving during each exercise, if it's not painful, if we have good progress. But generally, in the whole group, I usually recommend doing that.
Okay. Then the next claim was, don't do planks in the first trimester.
Okay, so this is, I don't understand why the claim is like that. So planks are good exercises. There are many people who love planks. There are some people who don't like planks because they are technically difficult to be performed. So it's always what you like to do, but for sure it's not dangerous. And what I even do, I recommend continuing doing planks, even if the pregnancy is progressing. So even during the second trimester or third trimester, I have some participants that are still doing planks, even if the pregnancy is very advanced. We must be aware that if the technique is not correct, we can decrease the severity of back pain. So a woman should be well trained to keep the proper technique by the end of pregnancy. But if she is able to do that, it's a good exercise for her as any other exercises which are on the list not to be done.
I see. So then cycling is not good for you because the weight is pushing down, when you are at the seat. How's about that?
Cycling is not. Also, so this is stupid actually, because cycling is good for the back, and I recommend cycling for these women who cannot jog because of the back pain or because of the pelvic floor muscle problems. So if the urinary incontinence is very severe, so cycling would be good for them because they sit, so they have good support from outside the body, and we don't have the high impact that can decrease the pelvic floor muscle problems. So for sure, I would recommend cycling for many reasons. As I mentioned before, that you are enjoying environment, natural environment, and it's active transportation. You can do it with the family together, with the friends. So yeah, so it's stupid. It's stupid and harmful. As I said, some myths are harmful, and we should put such influencers into jail, spreading such information.
I found a study in the meanwhile, by the way. So let me go back to that. Probably it was, I hope I pronounced the name right, Jorun Bakken-Sperstad, and it was published in June 2016. So what they found out is the following. So the prevalence of the diastasis recti was 33.1%. That is at the gestation week 21. And then they measure it 6 weeks, 6 months, and 12 months postpartum. So so 6 weeks, 6 months, and 12 months postpartum, the results were the following: 60% had still, according to the two finger measures, 60% were still having it 6 weeks postpartum. Only 45.4% had it still 6 months postpartum, and it went down to 32.6% 12 months after birth. So it's not even close to 98% what the influencers claim, right?
Yes, and as I said, so it is again important what classification we use. So even this 12-month postpartum, so maybe these bellies were quite okay. So we are worried when you can see a hole in the belly. So yes, this is something that we should treat seriously, both especially for some aesthetical reasons, but also because we need the abdominal wall at the front of the body. So it's important, but sometimes the separation is not disturbing too much. So it's slowly getting lower and lower, and using better technique, probably we can support the mother how to treat it, and it will disappear. I said probably because it's not so clear, and I must underline again that there's no gold standard for the treatment of diastasis recti. Many physiotherapists sell for huge money, gold methods that for sure it will work. But again, we must individually assess and adjust the treatment method to the situation, to the condition of the mother. And some methods will work for one body, other will not. But exercises generally are useful to prevent, and we observe the lower rate of diastasis recti in active women.
Okay, then the next claim would be the following: you should not start exercising for the first 3 months after giving birth.
After giving birth,
Yeah.
So our recommendations, and it's not only our Polish, but it's from American College of Sports, Sports Medicine, American ACOG, American College of Obstetricians and Gynecologists.
Yeah.
So the recommendation again is clear: as soon as medically safe. So if the mother leaves the hospital, if she feels okay, if she was checked in terms of pelvic floor muscles, the female organs, and if any injuries are not disturbing exercise, she can start slowly, because it's not that the pregnancy didn't cause anything and that the birth didn't cause anything. So usually it is a very demanding situation in women's life. So they must have time to rest, to recover, but some exercises, simple exercises to increase the circulation should be performed even 1 day, 2 days after giving birth. Pelvic floor muscles as soon as possible, immediately, if a woman feels comfortable with that. So even on the same day of giving birth, just to check if it was not damaged during natural birth. So no, waiting for 3 months is harmful. It's harmful for both the mother and the baby, because we would like them not only to have healthy bodies, but also to feel nice, a nice woman, an efficient mother in doing everyday stuff.
Here's the last one for today. I mean, the myth. So no woman should lift more than 3 kilos.
Once again, sorry, I don't believe what you read.
That was actually the trainer of Gwyneth Paltrow, Tracy Anderson, claiming that was in the mid 2010, so around 2014, 15, that she said that. So no woman should lift more than 3 kilograms, and that's why she trained Gwyneth Paltrow with no more than 3 kilograms. But I just want to provoke that laugh as well, because it's so, pardon my language, it's so freaking stupid, because that would mean that you're not allowed to carry your baby around. But on the other hand, you then hire a nanny to do that for you. But she's a female as well. So how does that add up? It's just funny, the claims that we've heard.
Yes, that's true. And again, so it's not logical. So if you have a baby, so sometimes the baby has around 3.5 kilos when the baby is born, or it can be around 4 kilograms. And after a few weeks, it's 5, 6, 8 kilograms, right? So as you said,
Exactly.
So about carrying the baby, and it's not the baby only, but having different stuff in your hands.
Bags.
Always, going to do shopping or just to go for a walk, and carrying everything together with you. So you have a lot of stuff on you. So it's ridiculous. Okay, so doing everyday activities, you are carrying around 15 kilograms, and you cannot exercise with the barbells like 3. It's not.
Yeah. That's ridiculous. I know. Okay, there's one more thing that I would like to ask you for today, and especially how, in your opinion or in your experience, how does training affect breastfeeding?
So we have only a few data on that. First of all, that the quality and quantity of milk is not changed when a mother exercises even intensively, but we for sure require more data on that topic. So we would like to say that it supports the lactation, but it's no data on that so far. Good evidence and good quality data. But generally, when we think about how the body works, so lactation is a very demanding process for the body. So if the mother is stronger, the body works better and more effectively through exercise, because we improve the circulation and all the organs that should support all the processes. So it is logically that
Okay, so we have tremendous claims. You were just cut off in between, Anna, so welcome back. So what would be your recommendation, the final one, for trainers and pregnant females and young mothers, of course, alike? So what would be your words of wisdom to them?
So can you say the question once again? So what I would recommend them, or
so, yeah, what would be your words of wisdom? So what would your message be for trainers, pregnant women, and young mothers? Okay. How to take on exercise and a healthy lifestyle?
So first of all, so this is a very physiological part of the of the podcast. Yeah, so we need to move. So this is always what I repeat. So the body must move. So during pregnancy and during postpartum, we must move. So if you are a mother, so you are moving not only for yourself, but also for the baby. So starting from the very early stage of pregnancy, you should exercise, and it's not only responsibility for you, but for the future generations. So sometimes we must also remember that working out, we support the whole planet. So maybe it sounds strange, but if we have healthier body, the future generation will be healthier, and we have healthier citizens of our planet, and we are more creative, we work better, we spend less money on health service. So we must remember about that. And also it's important to underline that even the third generation benefits from the maternal exercise. So now we have some studies that prove that the grandmother exercise influence the health of the baby. So it's not only for you, for your baby, but for your grandchildren as well. So this is my message. And for the exercise professionals, they should not be worried. They do a great work. They do something very important, not only because they like working out with the client, but they also support the future generation in terms of health and proper development.
Thank you for that. Thank you for taking the time away of your work to talk to me today. I really appreciate that. And I'm looking forward to see you very soon on the educational seminars and courses that we're doing with you. So if you're interested in any kind of work with Anna, find everything below in the description. You will have all the links and everything that I want to share with you down below. Follow Anna around, follow her on Facebook. You have an Instagram account as well, so that we can follow. Or are you not sharing too many things on Instagram?
What do you mean? What I'm sharing? I'm sharing everything. I have ResearchGate
for the followers. For the followers, so what they should follow if they want to follow you around. Instagram, Facebook, anything else?
Yes, I am on Facebook. So I must say that I'm not the influencer. Okay, I don't have time on that. I'm sorry. So you are my my supporter in the term. So I publish a lot. I have our Facebook is Facebook, but we have ResearchGate where you can find all the publications. So it's some kind of Facebook for scientists. Okay, well, we are sharing their comments and concerns about projects and scientific achievements. So you can find all my papers there. And we have the NEPE project website. So the new era of pregnancy and postpartum exercise. And you can find there the product of our collaboration, international collaboration. So it's nice to have a look there because some resources are completely for free. We have many booklets, guidelines, and these are evidence-based guidelines. But most of us don't have time to to promote it as many influencers do. So maybe it's time to promote like that.
True. Thanks, Anna, again. I'm looking forward to see you soon. Thank you.
Thank you very much. And I hope to see many people on our seminar, okay? And that I will have chance to meet you in real life and teach you how to work with pregnant and postpartum clients.